Okay, I'm Christy Smith. This is my head-to-toe assessment with Dr. Perry for the spring of 2025. I'm going to scan my supply table. Here's my supply table. I'm going to scan the room. I'm going to scan the floor, the ceiling, okay, so first I'm going to be looking at her skin. We're going to assess that for color, temperature, moisture, tuger, texture, nevi, lesions, scarring, bruising, edema, and nevi. We're going to look at the face, the head, the anterior chest, the posterior chest, the arms, and the legs. And for color and temperature, then we are going to look at her head. It's normal cephalic and midline. I'm going to look at her hair distribution is even. The color is brown and blonde. I am going to, it's midline and normal cephalic, her head is. Then we're going to feel for any indentions, any infestations, any depressions, any masses, any tenderness. We are going to next assess her temporal arteries for tenderness. Then we're going to palpate her lymph nodes in the head and neck, preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. I am going to test for TMJ by open, close, move your jaw side to side, no subluxation, no tenderness, no crepitus. I'm also going to assess cranial nerve number 5, which is the trigeminal nerve, by you clenching your masseter. Very good. Also, if you'll close your eyes for me, we're going to do the sensory light touch. Tell me where I'm touching you.
Forehead, nose, cheek, chin.
Cranial nerve number 5 is intact, trigeminal. I'm also going to assess next her facial nerve, cranial nerve number 7, by smile. If you can smile, raise your eyebrows, pucker your cheeks, puff your cheeks, pucker your lips, and frown. Okay, so cranial nerve 7 is intact, which is the facial nerve. Next, we are going to look at the ears, make sure they're symmetric, and they are. The shape of her ears. I'm going to feel the pinnae and the tragus for any masses or any lesions. I'm going to look at the auditory canal on the left, which is clear. Tympanic membrane is pearly gray. On the right, tympanic membrane is pearly gray. Auditory canal is patent and clear. I'm also going to test cranial nerve 8, which is the vestibular cochlear nerve, by 3 hearing tests. The first one is the whisper test. You can cover your right ear for me. Tell me what you hear.
1, 2, 3.
Okay, over the other ear.
1, 2, 3.
Very good. I'm going to also do the Weber test, which the Weber test is for lateralization. You tell me if you hear it in one ear or the other louder, or equally in both ears.
Both.
Okay. I'm also going to check the Rene test for air conduction and bone conduction, bone conduction, and air conduction. This is 1 and this is 2. You tell me which one you hear louder.
2.
Okay.
2.
Okay. So that tells me that air conduction is greater than bone conduction. Okay, that's the hearing test. Next, we are going to look at the eyes and look at her lashes, her brows, her sclera, her conjunctiva. Make sure there's no lesions, no discharge, any drainage. Looks clear. We are going to assess cranial nerve number 2, which is the optic nerve, by the visual acuity test and peripheral vision test. You can cover your right eye and read.
LTFPH.
Cover the other eye.
LTFPH.
And if both eyes.
LTFPH.
Okay, I'm also going to check her peripheral vision by you telling me when you can see my hands. Okay, so cranial nerve 2, the optic nerve is intact, peripheral and central vision. Next, I am going to assess cranial nerve number 3, which is the oculomotor nerve, which by pupillary response and accommodation, which they both respond to light and accommodate. So cranial nerve number 3, oculomotor, is intact. If you can pick a spot on the wall there and look at that, and I need you to follow my finger in. Accommodation and convergence was met. Okay. Next, I'm going to assess cranial nerve number 3, oculomotor, cranial nerve number 4, trochlear, and cranial nerve number 6, the abducens nerve, by doing the 6 fields of conjugate gaze. If you'll follow my finger. Okay, so cranial nerve 3, 4, and 6 are intact. I'm going to assess her pupils for red light reflex on the left. Red light reflex is positive. Structures are sharp and good. Red light reflex is positive. Structures are good. Margins are sharp. The eyes. Next, we're going to go to the nose. It's midline, straight, nares or patent. You will close your eyes for me. I'm going to assess cranial nerve number 1, which is the olfactory nerve, the sense of smell. Okay, if you'll tell me what you smell on this side.
Alcohol.
Okay. Cover the other nostril.
Perfume.
Okay, very good. So cranial nerve number 1 is intact, the olfactory nerve, and the nares are patent. Next, I'm going to palpate her frontal and her maxillary sinuses. Okay, next I'm going to move down to her lips. I'm going to look at her lips, her teeth, her buccal mucosa, her salivary ducts under her tongue, under the tongue, and her tonsils and buccal mucosa. Look at your teeth. Okay, if you'll just stick your tongue out and say ah. Okay, tonsils are absent, and cranial nerve number 9, glossopharyngeal, and number 10, the vagus, are intact due to uvula and soft palate rise with phonation. If you'll stick your tongue out for me, it's midline. If you will move your tongue up and down and from side to side. Cranial nerve 12 is intact, which is the hypoglossal nerve, and no fasciculations were seen. Okay? Next, now I'm going to look at her neck. Her trachea is midline, and I'm going to palpate her thyroid by pushing to the left, and then I'm going to push to the right. If you will tilt your head back and swallow, swallow. Very good. And I'm going to feel for pulsations on the left, pulsations on the right. I'm going to listen for bruise with my stethoscope, with the bell of my stethoscope. Okay, if you just hold your breath for a second. No bruise, we're on the left. No bruise or on the right. I'm also going to assess the posterior chest now, if you'll turn around for me. I'm going to look for any respiratory distress, any tripod positioning, any retractions, any nasal flaring, any cyanosis, any tachypnea. I'm going to test for chest expansion. Take a deep breath. We're going to check for tactile fremitus by saying 99, 99, 99. I'm going to percuss over each lung field. Okay, I'm going to auscultate over each lung field with the diaphragm of my stethoscope starting above the scapula. I'm going to listen to the lateral lungs and also the base of the lungs. I'm also going to listen to the right mid lobe on the right. Then I'm going to check for egopathy. Say E. 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 E.
E.
I'm going to check for bronchopathy, say 99.
99, 99, 99, 99, 99, 99.
I'm going to check for whisper pectoriliquy by saying 1, 2, 3. Whisper. Okay, if you'll turn back around, we're going to look at the anterior chest and we're going to make sure there's no deformities. We're going to look at the symmetry of the chest. We are going to check for chest expansion first. Take a deep breath. We're going to check for tactile fremitus by saying 99,
99,
99,
99,
99.
99.
We're going to auscultate the lung fields with the diaphragm of my stethoscope. Okay, then we're going to listen to the heart, aortic, second intercostal space, right sternal border. Pulmonic is the second intercostal space, left sternal border. Erb's point is the third intercostal space, left sternal border. Tricuspid is the fourth intercostal space, left sternal border. Mitral is the fifth intercostal space, mid-clavicular line. Then we're going to listen to it with my bell of my stethoscope, aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. Now I'm going to need you to go over to the couch, please, and I'll move my camera. Her head is going to be at 30 to 45 degrees, and we are going to look for JVD first, and I'm going to inspect for any thrills or looking for any heaves or lifts, and I'm going to palpate over each cardiac point for any thrills. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Then I'm going to auscultate with her being in the supine position with the diaphragm and the bell of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Then I'm going to use the bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Then I'm going to look at her abdomen. We're going to move down to her abdomen. We're going to look for contours and symmetry. And we are going to listen with the bell of my stethoscope to the arteries, which is aortic, renal, iliac, and femoral. Then I'm going to auscultate her bowel sounds at all 4 quadrants. Okay, then I'm going to percuss over each quadrant. I felt dullness, tympany, and flatness over each quadrant. I'm going to feel for any tenderness or any masses in the abdomen. Then I'm going to palpate the liver on the right. If you'll hold your breath for just a second. No masses or tenderness on the liver. The spleen is on the left. Hold your breath for me for a second. Okay, no masses or tenderness on the left. If you will come back up, we're going to do the musculoskeletal portion. Let me finish. Let's see here. Okay, one more thing before you get up. I'm going to check for CVA tenderness. Does that hurt? Does that hurt? Okay. All right. We will go do the musculoskeletal portion. Okay. So I'm going to look at her hands, her fingers, her wrist, her elbows, and her shoulders. We are going to look for any swelling, any edema, any deformities, any crepitus, any redness. I'm going to check capillary refill on each side, which is less than 3 seconds. I'm going to check her radial pulse on each side, which is 2+. Okay, so if you'll just do, we're going to do the range of motion in your fingers. So if you'll just do, alrighty. Alright, ready? Here we go. Flexion, extension, hyperextension. We're going to do abduction and adduction. We're going to do thumb phonation, or thumb opposition. Then we're going to do the wrist, flexion, extension, hyperextension. We're going to do ulnar deviation, radial deviation. We're going to do rotation. Okay. We're going to do range of motion of the elbows, which is flexion, extension, flexion, extension, hyperextension. Okay, we'll do that again. Flexion, extension, hyperextension. The elbows, then we're going to do the shoulders. We're going to do abduction first. Okay, so abduction, 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 adduction. Then we're going to do the shoulders, flexion, extension, hyperextension, internal rotation, external rotation. And we're going to do circumduction. Okay, very good. We are going to now test for strengths, her hand strength. Hand strength is 5 out of 5. We're going to test her biceps and triceps by you bending your elbows for me. Biceps and triceps, push against me, pull against me. 5 out of 5. We are going to hold your arms straight out. We're going to test for shoulder girdle. If you'll pull up and push down, 5 out of 5. Then we are going to assess the spinal accessory nerve, cranial nerve number 11, by her pressing up on my hands against resistance. Very good. Cranial nerve 11 is intact. Then I'm going to assess for cerebellar coordination with rapid hand movements. First, we're going to do hand flip-flop. Then we are going to do serial thumb opposition. Then we are going to do nose to finger 3 times. All right, very good. Then we're going to check for stereognosis and graphesthesia. You'll close your eyes for me. Tell me what you have in the left hand.
A coin.
Okay. If you'll tell me what's in the right hand.
Paperclip.
Okay, very good. Now I'm going to keep your eyes closed. We're going to check for graphesthesia. If you'll tell me what I'm drawing on your hand, okay?
The number 8.
Okay.
The letter B.
Very good. Okay, so next we're going to be looking at the overall warmth and color of the skin integrity, and we're going to make sure there's no edema on the upper or lower extremities. I'm going to do sensory by light touch. If you would close your eyes for me, tell me where you feel this.
Arm. Leg.
Okay.
Arm. Leg.
Okay, very good. Okay, I am going to check for vibratory sensation on the ulnar of both wrists, and you just tell me if you feel this.
Yeah.
Also the medial ankle. Do you feel that?
Mm-hmm.
Medial ankle. Okay. All right, so then we've got that completed. Now we're going to check, we're going to look at next the toes and the toes, the ankles, and the knees and the hips. We are going to look for any swelling, any edema, any deformities, any crepitus. Okay, I'm going to check for capillary refill in both toes. Less than 3 seconds. I'm going to feel for dorsalis pedis on each foot and the tibial pulses in the back, which are 2+. I am going to, we're going to do range of motion of the toes. If you'll just follow my hands. Make this go back. And just do your toes, flexion, extension, hyperextension. We are going to do abduction and adduction. We are going to do, let's see, abduction and adduction. Then we are going to the ankles, and we are going to do dorsiflexion, up, down, plantar flexion, dorsiflexion, up, plantar flexion, down, ankles. Then we are going to do inversion and E version. Okay, we are going to do rotation. Okay, rotate, very good. Okay, next we're going to test for the strength and of her feet and ankles. The strength of your feet and ankles. So lift up, dorsiflexion, press down, plantar flexion, press up, dorsiflexion, press down. Dorsiflexion and plantar flexion is 5 out of 5. I'm going to test the strength of her knees by pushing against me and then pulling back against me, push against me and pull back against me. We're going to check the strength of her hips in and then out, 5 out of 5. Okay, so next we're going to do the deep tendon reflexes, which give me your arm. This is the brachioradialis, bicep, tricep, brachioradialis, bicep, and tricep. We're going to do the patella on the left, patella on the right. We're going to do the Achilles on each side. We're going to do Babinski's and Babinski's. Okay. All right, we got that done. And then we are going to stand up and we are going to do range of motion of the hips first. So flexion, extension, hyperextension, flexion, extension, hyperextension, abduction, adduction, abduction, adduction, circumduction. We're going to do internal rotation, external rotation, internal rotation, external rotation. Next, we're going to do the knees, flexion, extension, hyperextension, flexion, extension, hyperextension. Okay, we're going to do the lumbar spine next. Okay, if you'll do flexion, you'll bend over. We're going to look at the spine, the alignment, make sure there's no deformities, any scoliosis, any tenderness. That's flexion, extension, stand up. And then hyperextension, lean back. We're going to do lateral flexion to the left, lateral flexion to the right. Then we're going to do rotation of the lumbar spine. Next, we're going to do the cervical spine, which look down, flexion, extension, hyperextension. We're going to do left flexion, and we're going to go right flexion of the neck. And then we're going to do circumduction of the neck. Okay, next we are going to do Romberg's test. If you'll hold your arm straight out for me. Okay, no sway. Now, if you will walk across the room, just regular. Okay, and then if you'll come back to me, heel to toe, heel to toe, heel to toe. Very good. Now, if you will just hop on one foot, on each foot, and that concludes my head to toe assessment.